Hi, welcome back to Mental Health Mondays with Dr. David Morgan. Thank you for tuning in. Thanks to Onward Productions for providing this opportunity for me to talk with you about mental health issues and the gospel of Jesus Christ. If you have questions for me, here's how you reach me. If you've seen this before, you'll know this. This is email onward.mental.health.mondays@gmail.com. Any questions you have about mental health issues. I really strive to answer all the questions I get. And I look forward to any comments you have. So that is how you can get in touch with me. This week's topic has to do with obsessive-compulsive disorder. It's one of my friends asked about that. And in addition to just some general thoughts about mental health diagnosis. So let's talk a little bit about obsessive-compulsive disorder, or otherwise known as OCD. It used to be an anxiety disorder. And it has a lot to do with an anxiety. It used to be in the category of anxiety disorders in previous editions of the Diagnostic and Statistical Manual of Mental Disorders. That's called the DSM. And that is like this big book of all the mental health diagnoses that there are. It's currently in its 5th edition. And in the 5th edition, OCD was moved from the anxiety disorder section to what they called the obsessive compulsive and related disorders. So it kind of has its own little group now. And so the hallmark of obsessive compulsive disorder are in what are called obsessions and compulsions. Obsessions refer to thoughts and compulsions refer to behaviors. And so let me read to you some of the diagnostic criteria. So obsessions are defined as recurrent and persistent thoughts or urges that are unwanted and intrusive, which also cause marked anxiety and distress. Compulsions are defined as repetitive behaviors such as hand washing or checking, or mental acts such as counting or repeating words that the individual feels driven to perform in response to an obsession. The behaviors or mental acts are aimed at preventing or reducing anxiety and distress. So it's a combination of these kind of unwanted intrusive thoughts and then these kind of persistent intrusive behaviors or mental behaviors that are designed to decrease the anxiety that is created by the thought process. Now, the other thing, and this is important, is that these obsessions or compulsions have to be time consuming. The diagnostic criteria says at least taking more than 1 hour a day, and it needs to cause clinically significant distress in areas of like social or occupational or other important areas of functioning. That's a very important thing that we'll talk about here in a little bit. Typically, obsessive-compulsive disorder is treated through a combination of therapy and medication, just depending on the severity. Medication can be helpful. In my experience, medication for anxiety issues tends to be a little less effective than it is for depression issues. Not to say that it doesn't work, just in dealing with literally thousands of clients, that's kind of the repeated thing I've heard, is that they say that their depression medication tends to work great for depression. Their anxiety medication tends to work a little less great for their anxiety symptoms. So depending on the severity of obsessive compulsive disorder, medication may be indicated. Therapy is almost always indicated for this. If you have obsessive compulsive disorder and you're trying to manage it just with medication alone, I strongly encourage you to get into counseling and use that as well. The gold standard for treating obsessive compulsive disorder in counseling is what's called cognitive behavioral therapy. And there are some specific kind of variations of that therapy which can be used. If you can find someone who specializes in the treatment of anxiety disorders or obsessive compulsive disorders, that's even better. Generally speaking, people that say they specialize, if you go to a counselor and they say they specialize in 50 different things, that usually means they don't specialize in anything. No one specializes in 50 things. We usually specialize in 1 to 2 things, and we may be able to do other things with some effectiveness. For example, I don't specialize in anxiety disorders. I can treat anxiety disorders. I'm probably not the best person to treat them because there are other people who are much more effective. I specialize more in forensic psychological issues, and am an expert in that. And like I said, my expertise is limited to just a few things. So if you can find someone who specializes, that's great. Depending on the severity and chronicity of obsessive compulsive disorder, you also might have to go to therapy multiple times. And when I say that, I don't mean multiple sessions. I mean, you might go for 3 months and then not go for a year, and then go back for 3 months or 6 months, and then be off for 2 years. Sometimes mental health issues can be chronic, and we need to get repeated help for it, and that's okay. It's like physical health issues. Sometimes we go to the doctor for one thing and then we go back for another thing, or maybe it's related to that thing we had before. Um, I think part of that is in line with our Heavenly Father's plan. He gives us weakness so that we will turn to Him and that we'll be humble. Ether 12:27 says, "And if men come unto me, I will show unto them their weakness. I give unto men weakness that they may be humble. And my grace is sufficient for all men that humble themselves before me. For if they humble themselves before me and have faith in me, then will I make weak things become strong unto them." It's that weakness that keeps us coming back to Heavenly Father. So if you have mental health issues that don't seem to go away, don't worry. I really think that's kind of part of the plan. Get help for it and try to move on. Now let's talk a little bit just about diagnosis in general. And if you've heard me talk about this before, this is familiar to you. My first rule is please don't self-diagnose. I realize there's a risk of me listing the diagnostic criteria of obsessive compulsive disorder because someone will say, "Oh, I've got that." Don't self-diagnose. The diagnostic criteria are widely available on the internet, but that's not your job. Unless you're a mental health professional watching this, in which case it is your job. But if you are just someone who suffers from this, don't self-diagnose. Also, don't presume that just because you have a feature of some sort of mental health diagnosis, that means you have the full diagnosis. When I was an undergrad at Brigham Young University, I took a class called Abnormal Psychology, and that's where we learned about all these different diagnoses. And I swear every day I came home thinking I had a different diagnosis. They'd go over that and they say, "Well, I got that." And then we'd do something else. "Well, I got that too." Well, I didn't have all of those diagnoses, but what I did is I had some features of them. I had some elements of each of those things, and I think that's probably pretty common. If you felt depressed yesterday, or even for the past couple of days, you wouldn't automatically presume that you have major depressive disorder. You would just say, "I've been depressed for the last couple of days." Same thing goes with anxiety, or if you have some intrusive thoughts, you don't say, "Oh my gosh, now I have obsessive compulsive disorder." Maybe it's just a little thing that you're going through. Now, it could be indicative of something more significant, but it isn't necessarily. That's why it's important to get diagnosed by someone who is credentialed and licensed to do this. These diagnoses almost always talk about there being clinically significant impairment in something. So even if you have a feature of a diagnosis, but it's not causing clinically significant impairment, then you don't have the diagnosis. And that's why we need a clinician, someone who has information and skill to be able to diagnose that. The other thing that's important to remember is that diagnoses are just labels. They're labels that mental health professionals use to communicate and to describe things. Sometimes they inform treatment to a certain extent, and for that reason, they can be a little bit important. But most of the time, in treatment and counseling, when the rubber meets the road, we're just trying to fix problems. And I thought of an example. It's like if you're going on a hike and all of a sudden there's a big boulder in the middle of the path. What do you have to do? You have to get around the boulder somehow. Now, you could spend a lot of time describing the boulder, figuring out what kind of rock it is, learning the history of the boulder, talking about how your parents encountered similar boulders on their paths when they were hiking. That's all well and good, and you could probably come to a very, very good understanding of that boulder. But at the end of the day, you got to get around it, or you got to get over it. And my approach to counseling is very pragmatic that way. So while diagnosis can be helpful, like I said, in informing treatment strategies, it's not the most important thing. So please don't get hung up on diagnoses. Don't get hung up on this idea, well, I have this condition, therefore that means this, this, and this. It's really just there to help us mental health professionals. And regardless of what we call the boulder, regardless of what it's made of, we still need to figure out strategies to get around it. So I suggest spending less time on describing the condition and figuring out what it's about, and more time trying to get around it and get through it. So that's my philosophy, and that's my advice to you. We only have a limited amount of emotional energy to begin with, so let's use it where it's most effective. So once again, thanks to everyone for watching. If you have any questions, again, my email was at the beginning of the video. You can also find me on Instagram at LDS Psychologist, or on my website at www.ldspsychologist.com. You can find links there to all the Mental Health Monday episodes that I've done. This is number 34. So there's quite a bit of information out there. There's also links to my blogs and books that I've written and some videos that I've done. So other videos. So lots of information there. Again, thanks for watching. Remember that change is possible, but that change requires action, and always keep moving forward. Thanks, and we'll see you next time. Bye-bye.